So we saw no cases of flu the entire year last year.
Last year, the Nemours Children's Hospital in Delaware saw no flu and barely any of the more normal common colds. But now
that it's back, it's spreading pretty rapidly.
Nemours Emergency Department had over 20,000 visits, about 250 per day between August and September. This is far above the average number of patients who came in during the height of the pandemic. It's really increasing wait times, and many of those moms and dads probably did not need to bring their kids here first. With kids separated and masked up for so long, many of the colds and viruses we normally see, they weren't floating around as much. That was a good thing. But now that everybody's back together, colds and viruses are making a comeback, and understandably, many of us parents look at a cold symptom and go, is it cold or is it COVID? Let's be clear, if your child is struggling to breathe or is very dehydrated, get them to the ER at your local hospital right away. But for most symptoms,
fevers, coughs, sore throats, runny noses.
Yeah, for those, you should call your pediatrician for guidance first. Maybe they'll bring you in, maybe they'll send you to an urgent care center, or maybe they'll tell you how to treat things at home. And if your child has some of those less dangerous symptoms and you just need to get a COVID test, Nemours says don't go to the ER.
That's really all you need to know is this COVID and can I go back to school? It's better to do that in one of the community testing centers.
Look, I know it can be confusing and a little bit scary, but we need to keep the ERs ready for the people, or in this case, the children who need them most. In Wilmington, Tim Furlong, NBC 10 News.